Facebook. Hey, welcome to our second attempt at our Facebook Live session today. Our internet was giving us grief earlier, but we're going to teach you, or we're actually going to demonstrate what we were talking about at the Colorado Springs School of Massage, manual passive stretching. Man, that is one of the best things that you could receive, and if you haven't received it yet, make an appointment. But come here, let me show you what this looks like. We have a demonstrator today. She's demonstrating. This is Marla. Say hi to Marla.
Hi.
Hey, Marla.
This is one of our students.
Yeah. So let's start with the head and neck. As you can imagine, like we said earlier, the head and neck moves in so many different directions. And imagine a car accident where you hit somebody, your head whips forward, whips back, and so you've got front and back stuff going on. We also wind up with lateral neck muscles that are involved in these things. So let me show you some of the things we do. I'm going to go ahead and support Marla's head so that we're not dragging her hair all over the table. But we're going to go ahead and flex laterally to the right. And we're going to go as far as it comfortably goes. You can feel a certain level of resistance, and then we're going to hold it there for about 15 seconds. Let those muscles find a new normal resting length. Now, the beauty of manual passive stretching is she's not doing anything. She's just laying there, enjoying the stretches. Let me know. Is that good there? Okay, good.
April is watching.
Hey, April! We're back on. We're back on. We figured it out. And then we're going to do rotation to the left. Can you imagine you got in a car wreck and you can't turn your head to look over your shoulder? This is an amazing stretch to help relieve that. I'm going to rotate over to the right too, because whatever you do to one side, you want to do to the other. We're going to go ahead and lift the head and do some flexion. And each one of these, 10 to 15 seconds. And then I'm going to support her neck and do an extension so that we could extend her neck backwards. We're going to loosen all of the anterior neck muscles. Oh, that was good. Did you like that? Would you like some traction?
Yeah.
Some traction is always nice. And go ahead in there and just kind of lengthen her neck a little bit. All of the cervical structures are being kind of gapped a little bit. We're stretching them out. Get some fresh synovial fluid in there, the lubricant for the joints. Thank you, Marla. So let's do some stretches for the arms. Now, while we're down here, we can do a downward stretch. And as you can imagine, we're stretching out the upper trap, all of these upper structures up here. Very nice, comfortable stretch. Let's go in the opposite direction. We're very careful about the shoulder joint here. So we just want to do a nice, comfortable stretch, stretching out the pecs, stretching out the latissimus, and all of the other supporting structures. Let's come up this way. Come up this way. Are you liking these?
Very much.
Good. And then let's go across the body. As we go across the body, let's help the shoulder a little bit. And we're loosening up all of those between the shoulder blade muscles. For those students that are watching, what are some of those? Rhomboids, middle trap, right?
Mm-hmm.
We're going to quiz you. So we got the arm. Normally I would go around and do the other arm, but our videographer's on that side, so I'll work all the stuff on this side, and then we'll take care of the other stuff later. Let's do an upper body stretch. You want one of those?
Yeah.
What I'm going to do is I'm going to hold this hip down, and then I'm going to rotate her upper body, and I'm going to bend her upper body. And this is a super cool stretch. We're going to come this way. Now, if she was covered with a drape, I would go ahead and I would pin the drape to her back with my hand. But so that you can see what I'm doing, notice that I'm driving with my legs. I'm not using my upper body. I'm just holding her. And this stretches for her lower back and for her side. Does that feel good?
Wonderful.
You know what? I want to go over here. Let's do the other side. Let's balance her out. That's super important. There we go, Marla. Lean backwards. I want to take her body with me. Very nice. You got a good stretch on that one.
Yeah.
There you go. And you know what? While we're at it, we're on this side. Let's get this arm balanced out. If you noticed, I am very meticulous. When it comes to shoulder function, when we're going up overhead, I'm bringing it this way so that the ball and socket rotate normally. Rather than if I come up this way, we're going to jam things up here. So let's be super careful about that. I'm running out of breath with this mask on. Does that feel good? A properly done set of stretches can take 20 minutes out of your massage for those therapists that are adding this. So make sure that you know you've got enough time to deal with all of that. So let's do some hip lift kind of stretches. So I'm grabbing her right by the top of her hip, and I'm pushing down on her rib cage. And I'm going to hold the rib cage up, and I'm going to push down on her hip. We're introducing a torquing stretch to the low back in both directions when we do it this way and when we do it this way. From there, let's do some leg stretches. So you'll see us support the knee, kind of stabilizing it. But really, this is my little trick that reminds me that she has reached the maximum amount of stretch. And as we continue to go up, her knee is going to try to bend. Right there. And that is a subconscious effort to protect because we're reaching a pretty good stretch back here. Comfy?
Yeah.
Let's unload there. And we're going to come, if this was a clock, that's 12, that's 10 o'clock, that's 2 o'clock. Do all three. So we're at 10 o'clock. We're going to unload and come back to 12 o'clock. And we're going to go across to 2 o'clock. There's many different fiber directions in the glutes muscles, so we want to make sure and stretch as many of them out as we can. And then we'll go across the body. This is a favorite because, wow, everybody is tight in these particular muscles. You too, Marla? Really?
Surprise.
Surprise.
So what muscles are you addressing there?
Well, the first ones, when we were bringing the knee up to the chest, those were the glutes, properly the glutes. Now we're working on the lateral rotators, primarily piriformis. And for those of you that are familiar with piriformis syndrome causes sciatic pain. So it's really good to do that. Now we're stretching all the inner thigh muscles out with this stretch. Very good. Thank you, Marla. Rock it out, shake it out, and then we would continue with our massage. But we're going to demonstrate the posterior muscles that we stretch, which are in the prone position. So luckily I prepared this. All right, Marla, let's turn you over face down, please. So we stretched out the hamstrings by bringing the leg up. Remember that? Mm-hmm. Let's stretch out the anterior part of the thigh muscles, which are known as what, students? Quads. Good job. So we're going to stretch out the quads. Again, I feel resistance. I just want to hold it there and let the muscles stretch instead of me force it.
Now, is there a way to get that closer?
There are many different techniques, and we will be talking about these coming up in the future. There are muscle energy techniques, and there are some post-isometric relaxation type exercises, which we like to help our clients out with, which help restore more resting length to that muscle. Sometimes I like to go in here with my armpit, put my weight on there, and that stretches all of this out back here. Does that feel okay? Yeah. Good. So there's that. And then we also did some hip lift exercises, which notice how much movement we have here in the low back. That's a really good sign. When somebody is really stiff, you do this and the whole back moves as one piece instead of hips and not up here. Notice the difference. So let's go in there and I'm going to grab her by the hip, and I'm going to hold the rib cage down as I pick up on the hip. And what we're doing is we're creating a torque in her low back. Can you see the lines in her shirt?
Mm-hmm.
Yeah, that's really nice. How does that feel, Marla?
Great.
Awesome. And then because this is such a powerful stretch, we want to make sure and balance her out on the other side so that you can see what this looks like from the other side. Notice the lines are going in the opposite direction now. I mentioned earlier, we do not want to do this with any kind of force. We don't want to create a thrusting movement because then that's becoming a chiropractic adjustment. That's not the goal here. The goal here is to stretch out the tiny, tiny little muscles that are connecting the first vertebra to the next vertebra and on the way, all the way up to the top of the back. So we need to make sure that we stretch those all out, and we're doing it with this stretch. It looks gentle, but believe me, there's a lot of force in there. It's really strong. So with that, now we can go back into our massage and soothe all of these areas that we have already loosened with the stretches. How many of you would like to have one of these?
Oh, yeah.
Oh, yeah. So I would invite you, call us up on our landline, 719-444-0708. Let's get you on the calendar so that you can get one of these stretching sessions mixed in with some of the best deep tissue massage that you will ever experience. Because you know what? We can't wait to get our hands on you. So give us a call. We'll see you next week. Bye-bye.